Hello and welcome to West Texas VA Healthcare System's Vital Signs Podcast. I'm your host, Mike Cole, the Chief of Communication here at West Texas VA Healthcare System. So glad you're taking the time to listen or dial in and check this out. We have a very special guest with us here today, Miss Kelli Settles.
Hi there.
How are you?
I'm good.
Good.
You?
We're good.
Pretty good.
We're good. Kelli, tell our audience real quick how long you've been here working West Texas VA.
Sure. I started out in primary care in 2008, so 13 years this August.
And you've done a multitude of positions.
I have. I've been in primary care most of that time, implementation of PACT when that all came about. And then I went into group practice management. So I really have kind of touched every clinical service here for the most part. And then now I am acting as the Deputy ACOS of Behavioral Health. So
Kelli knows what she's talking about. When you want to know something about West Texas VA Healthcare System, this is the person I often reach out to. As many of you know, I've only been here about a year and a half. Mm-hmm. Started over in Dallas. And when you come into a role like this and you're looking to learn as fast as possible, you learn to rely on certain folks. And certainly, Kelli, you're one of those few that I count upon. So we talked a few weeks ago about enrollment and eligibility of our veterans and what that process looks like, what veterans need to do, what are our responsibilities when you do come in to enroll and get your eligibility checked out. The next logical step in that sequence is, okay, you've enrolled, you are eligible. Now we have to get you established.
Correct.
With a healthcare team at West Texas VA Healthcare System. What does that look like? What should the veteran expect after that enrollment and eligibility?
The biggest thing that I would say now, veterans should expect to leave the VA that first time with an appointment in hand, right? That's our goal. That's our desired end result, right? That they come in, they get registered, and then they are, we either send them across the hallway to get an appointment with primary care right then if they are registering in Big Spring, or the person entering in their information in a CBOC gives them their new patient appointment as well.
Okay, and what if their eligibility isn't
back yet?
Established? What?
Sure. So usually what happens then is the business office will follow up with the patient, let them know that they're good to go. It's good to go ahead and schedule. Most of the time when they make that contact with the patient, if it's via phone, then they'll transfer that patient and do a warm handoff with the call center. We have a scheduling call center. They can schedule appointments there. And so that the patient should get off that phone call with their new patient appointment for primary care.
So the very first thing the veteran should be looking for once they've come in and they filled out the 1010,
correct,
they've given over a copy of their DD-214, all of those things. The next thing they should be looking for is that first doctor's appointment.
Correct.
And that's your first encounter with your new doctor. So
your team.
It's a little more, okay, very good. See, this is why we keep her around. This is critical.
Absolutely.
And the first appointment is a little different than a normal appointment.
It is. So your new patient visit is an hour long. This allows your team to get to know you. You get to know your team. So and also we want to make sure that the patients come in prior to that appointment and go ahead and get their lab work drawn so that whenever they come in, that new patient visit is as powerful as, productive as possible.
And every new patient visit requires lab work in advance.
That's ideal state, yes.
So
yes, we want every patient to have lab work.
And we need our vets to understand these things so they know the right questions to ask.
Correct.
And I don't say this to try to put anybody on the spot or look, nobody's perfect, no program's perfect, but if we understand as a veteran,
yes,
hey, wait a minute, I remember hearing that maybe for my first one I'm supposed to go get lab work done. At least you know to ask the question of whoever's scheduling that appointment for you.
Correct.
Or if we're probably going to reach out once that appointment is set. We're probably going to reach out in a fashion or two.
We are.
To remind you
that
you have that appointment.
More than likely, you're going to receive a letter. You may receive a text, and you will receive a phone call as well. So
there you go. There's 3 ways we're going to try to reach out to you. If no one's told you need to do lab work prior to that first appointment,
right,
just expect it. And then ask the question. We all need reminders from time to time. Me, more so than ever. Ask my producer back here, Mr. Will Hatton, or Kelli Stoley in the other room, our big boss. I need a lot of reminders.
Oh, yes.
And I rely on them.
Yes.
So think about that lab work and that first appointment. Talk to our vets a little bit about, from your perspective, having been
Mm-hmm.
an RN in that PAC team setting.
Sure.
How should that first conversation go with your healthcare team?
So sometimes veterans feel a little overwhelmed when they first come in. There's a lot of questions. And sometimes those questions can be, well, they're very personal questions. And also they can be a little lengthy, So we really try to get a very good history of what's happened in the past, what has been your experience, what was your military experience. Many of our patients, although we want to become their healthcare provider the minute that they're discharged from the military, sometimes they don't choose VA until they're older in age. So we may have many patients that come in that, have been seeing a doctor in the private sector for years. Well, us trying to obtain that information can be a little overwhelming, all the history of the patient.
Sure.
So I can tell you, when you come in for that first appointment, expect lots of questions. But what I would say is be as honest as you can possibly be, because that kind of is the driver of what's next for you, or what other services that the VA can offer you to help you. So that they will go over, and your medications. That's huge. So if you've been getting medication from the private sector, or even another VA, maybe not bring them all, but definitely have a list ready so that the nurse and the provider can review those medications and make sure that you can now get them from the VA.
Sure. And you brought up so many good points there. I want to try to make sure I touch on one or two of them.
Sure.
It is your establishing appointment. That's
Right.
what you call it, right?
Right.
The establishing appointment. So the doc needs to know what's going on with you. I didn't come to the VA until after I left the service. It was 12 years.
Oh, wow. Mm-hmm.
And I did a lot of things
Sure,
in those 12 years,
sure.
many of which probably did have significant impacts on my
overall health. Sure.
So don't be intimidated by that. If there's one team on this planet you need to be as open with and forthright with, is your provider.
Absolutely.
And your nurse.
Yes.
Because let's face it, they're the ones going to be taking care of you down the road. Mm-hmm. Write down questions you may have before you come in. If you're like me, I'll point to my team here. They know I'll wake up at 2-3 in the morning with this idea in my head, and I keep telling myself I'm going to write down a note to remind myself in the morning. Mm-hmm. Do I ever do it? No. Do I ever remember it in the morning? No. Write those questions down.
Absolutely.
But you touch on something I think is critical, and it's one of the topics we're going to follow up with, is by that initial appointment, it's setting the table for a whole host of other services.
Correct.
You may not even be aware that the VA offers.
Oh, absolutely.
And the doc's not going to know, or the nurse is not going to know to offer this or make you aware of this if it's not applicable to your situation. So by all means, write those questions down. There are so many services out there. I'm still learning. I've been with the VA now, 3 years? Been getting VA services, filed for my VBA disability rating and all those things. I'm still learning every day something new about healthcare, about other areas. It doesn't happen overnight, folks.
Absolutely.
So, but if your team doesn't fully understand where you're at today, they have no idea where to send you for tomorrow.
Correct. And we are resource rich. We have so many services. We're the only healthcare organization that you can see specialty care, behavioral health. We really strive to take care of the whole person, and that means mind, body, and soul. So we really, if we don't know all those ins and outs, that's where primary care, when you have do those assessments, fill out those questionnaires, answer those questions, then those staff members, the nurses and the provider, can lead you to services that can absolutely help you.
Amazing things are out there, folks, if you just take the time to, one, listen, two, communicate clearly, and move forward. And I'm going to tell you straight up, and there's no organization out there in the world that's perfect, none. We do everything we can to do everything right the first, because our one goal, and you said this in a previous conversation that we had, that first impression.
Yes.
It's critical, and we know that. And most of our team knows that. So we strive to make that first impression the best possible impression it can be, so you'll want to come back. if you have concerns, you have questions that you don't feel comfortable with, we have other staff members you can talk to.
Oh, sure.
I talk to a great many of them.
I was going to say
Yeah.
They can come right down here.
You can come on down to our office, down in the public affairs office. We'll be happy to help wherever we can. We'll get other folks involved if we need to. Don't be shy.
Oh, absolutely.
Don't be shy with your
Ask those
doc.
questions and make sure that you fully are, you understand what's next or what we want you to do next.
Great point. Because for years I've been getting lab work done. We touched on that a little bit ago.
Yes.
And you get this whole laundry list of stuff that's written in Martian, I do believe, which I didn't study. And it took my nurse and my doc to sit down and say, okay, this line, this is what it means. This is the number you have. This is the number you should have.
Right.
Here's how you work to get to that number.
Exactly.
And they're really looking out. So I was pre-diabetic.
Okay.
I had no idea because I didn't know what those numbers meant.
Sure.
Until my VA doc and PAC team sat down and explained it to me. And they said, well, what does that mean?
Right.
What can I do is there anything I can do to change that? Or am I just stuck with this?
Sure.
And they started turning me on to resources about, eating
Yes.
healthier, how important a little bit of exercise each week.
Absolutely.
And now that number's back down where it ought to be.
Right. Well, and when that number goes down, you no longer need medicine. That's the goal, right? So we don't want to push medication on patients. We want you take medicine, of course, if it's necessary, but most of the time, lifestyle, behavior changes, things like that can really make an impact. And that's what our staff are, educated. They know those things so that they can give patients tips to really, make them or help them with changes to become more healthy.
And don't be afraid to ask, hey, if the doc says, hey, we're going to put you on this medication, don't be afraid to ask the question, is there anything I can do outside of medication to help? Because we have Marsha and her team down there, the nutritionists. Yes. We've got just a whole host of resources, like Kelly said.
Right.
So initial appointment, you've already done your enrollment, you've done your eligibility, you're coming in for that first appointment. Don't forget lab work. Got to get lab work done.
Hour-long visit.
So plan accordingly.
Yes.
And it's a fasting lab work, I would imagine, too.
Yes.
Real critical point because, like I said, I wake up at 2, 3 in the morning with these harebrained ideas. And instead of writing something down, I go out and get a snack. Can't do that when you're doing your lab work.
You should not do that. Correct. And so,
I shouldn't do it at all?
Probably not.
Probably not. Sometimes it's not a bad snack. It's not like I'm eating a Snickers bar. I'll grab a piece of turkey or
that's okay.
So, but not with lab work. That's what you should expect. An hour-long visit, meet your PAC team, get your lab work done. Be ready to have a rather lengthy conversation with your healthcare team.
Right.
And it is lengthy. We'll tell you straight up front because they're going to ask a whole lot of personal questions.
They are.
But they need to know.
Sure.
Don't be afraid of that.
Right. Well, and two, a huge component of care for the VA is prevention. So if we don't know what factors or what risk factors that you have, it's very hard to prevent you from becoming sick in the future. So we're going to be asking so many questions about, what are your daily routine? What do you do on a daily basis, a weekly basis, so that we can determine, this might be on the line of risky.
How best to guide you.
Correct.
And that's a critical point.
Yes.
And we had Miss Tracy Taylor in here to talk whole health.
Yes.
Previously. The first question, what are your goals? What do you want to do? Well, I'm 55. I'll be 56 soon. I have 6 grandchildren. At 65, I want to be able to go to the zoo with my grandkids and at least keep up at a modest pace. I'm not going to keep up with a 4-year-old continuously, but I don't want to be the one sitting
having to take rest
at the snack shack for an hour and a half, 2 hours while they're out. I want to be able to go with them. So, and that's kind of how they approach it. Said prevention.
Absolutely.
That's where we got my pre-diabetes numbers back where it's supposed to be. Yeah. My blood pressure numbers are back where they're supposed to be. So it's all starting to come together. Right. And I'm actually getting excited about getting out there and doing some of these things. I started getting into mountain biking and things of that nature.
Yes.
So
it's motivating.
It is. And it's motivating when you have a team that's helping motivate you with a purpose.
Correct.
Which is what your PAC team's going to do.
Right.
Because this is what they're trained for.
What is also, we also want the veteran to be the person driving the care. We want to know, just like that, what are your goals? There's patients that come in and they want to be able to walk their daughter down the aisle in 3 months.
Sure.
Well, we're going to do everything we can to make that happen. So those types of things. And when the patient is driving the care, then we're building partnerships, relationships, and then they know, hey, we're just as excited as they are when they meet those goals. So then usually they're with us for life at that point once we build that relationship. So,
and that's where we're at. That's
Yes.
where we want you to be. So please tune in when we get these. We'll have more following up, taking the next steps.
Okay. Sounds great.
Want to thank Kelli again so much for being
Absolutely.
here. What a pleasure having this conversation with you. It's always a joy. Don't forget to tune in. If you have any topics you'd like us to cover here at West Texas VA for you, if there's something you don't know, something you have a question about, please drop it in the comments below. Reach out to us at the Public Affairs Shop. Reach out to any of your providers and just tell them, get the question to me. We'll get it answered. We'll get the SME down here to be a guest and answer those questions for you. Thanks again for listening. This has been West Texas VA Healthcare System Vital Signs Podcast. We'll see you next time.